Well, good afternoon, everyone. Thank you so much for being here. I'm Adrienne Ammerman, founder and CEO of Arclet, and I'm really excited to share our journey at Arclet with you today in blending human expertise with AI to transform how we do public health communication. Our focus today is on how we can innovate ethically to build trust and relevance in an increasingly complex information environment. So here's a little bit about how we're going to be sharing our hour together here. We're going to tell you a little bit more about Arclet. We do have a lot of friends here who are very familiar with Arclet and who've been heavily involved in shaping the platform, but some of you have never heard about it at all. So we're going to give some context about what we're doing here. We're going to talk about the promise and the peril of leveraging AI to help us do our work. And we'll share the story of our National Science Foundation supported AI work that we've been doing over the past year and introduce Arli, our AI health communications co-pilot. And then finally, we'll wrap up with some key takeaways and action steps. I'm joined today by my colleagues, Marian Arledge, our Director of Public Health Initiatives, and Mason Youngblood, who's our lead AI engineer. And they're going to be helping me manage the chat and answer questions as they come up. And speaking of questions, we've got a lot of folks here today and a lot to cover. So if you don't mind keeping your audio on mute, you can type in questions as you have them. Hopefully we'll be able to answer a lot of questions over the course of the conversation and at the end of the webinar. But if we miss any, we'll be sure to cover them in an FAQ document that we'll share along with the slides after by the end of this week. So before we get too much further in here, I want to ask you all, how familiar are you with using AI in your work? And I'm going to open up this Menti poll. And you can take your phone, take a photo of the screen, use the QR code, or you can go to menti.com and enter this code. And you should get this first question. Let's see if this works. We're diving off the deep end here, starting off the webinar with using tech. Okay, we're already getting some responses. So we're just really curious to know here, out of the folks on the call, how many of you don't really use it at all? How many of you use it a little bit, occasionally, daily? And then I'm sure some of you on this call are, maybe even doing more with it than we are at Arclet. So either creating AI tools or working within AI, the AI space. So I'm seeing a good mix here. And let me share this tab so you can see what I'm seeing. Great. I love this. A couple of folks who've never used it at all, or maybe you've used it and we're like, that's not for me. And quite a few of you using it daily. So I'm sure we're going to have a lot of great questions and input as we go along here. All right. So I want to start by sharing a little bit about my own journey, because it really informs why we're building Arclet. So over the past 2 decades, I've navigated the complexities of nonprofit and public health communication at the local, regional, state, and national levels at places like the School-Based Health Alliance, the YWCA, direct service organizations. But a real turning point for me was when I started working at WNC Health Network, which is a regional public health nonprofit that's led collaborative community health assessment in our rural mountainous region since the mid-90s. I was inspired by the work I saw of bringing community health improvement leads together to try doing something similar with people who were in a communications role in the health departments and hospitals and community organizations in our region. And this led to the formation of the Western North Carolina Health Communicators Collaborative, which I helped lead from 2019 to 2024. We co-designed ways of working together across counties and agencies that have formed the basis of what we're building with Arclet. So this collaborative work and my work supporting state-level COVID communications response during the pandemic really brought into sharp focus the systemic problems facing public health communicators today. So we know that our information environment is dramatically different than it was a couple of decades ago and even just a couple of years ago. We're operating in an information environment that's saturated with information, while at the same time local independent news is folding, where misinformation spreads rapidly, where public trust in institutions is eroding. And at the same time, the people who are in these roles of being required and mandated and wanting to share trusted health information in their communities are facing immense pressures. NACCHO had a study in 2022, a report that showed that nearly 60% of health departments have 5 or fewer staff dedicated to communications. In my experience, the communicators I speak with, they're often a comms team of one, and communications is just one piece of the work that they do when it comes to having to address the communications needs of their communities. So we're really facing unprecedented challenges. And it's not just about getting information out, but it's ensuring that it's heard and understood and trusted. And there's a real localization gap where there's a struggle to adapt national and state level messaging in a way that works for local communities. This is a really persistent tool. So I want to pause here again and come back to our mentee and ask, what are some of the biggest challenges that you face when it comes to your communications work? And you can either answer this, mentee, or you can type your answers into the chat. Would love to hear from you. Staff capacity. Yeah, so underscoring what I just named about lots of times at our local agency, we don't even have a full-time person who's doing this work. We have one team that we're working with at Arclet where the agency doesn't have any full-time comms person, so they have 5 people at their health agency who together have formed a communications work group to try to meet all of the requirements of the communications needs of their agency. So I'm seeing a lot around staff capacity. Next up is reaching the right communities. So how are we not just talking to an echo chamber? How are we getting our messages out there? And limited time. Time is a huge one. I've talked to communicators who tell me that their part of their job is posting to their agency's socials, and that's what they do after they get home, feed their family dinner, they log back on, and that's when they're getting that part of their job done. Thank you for sharing that. So it sounds like a lot of you might relate to Elaine's story. Elaine is a composite of real public health professionals that we work with. Elaine's a public information officer at a local public health agency in a rural county facing a whooping cough outbreak. She's the PIO, but she's also the deputy health director, the health promotion supervisor, and she gives shots in the clinic. So she spends over 2 hours just drafting one social media post. And this is in a community where vaccination rates are already lower than the state average, making effective communication even more critical. So this highlights the immense capacity challenges faced by under-resourced health departments every single day. AI has already transformed our information ecosystem and has been doing so for quite some time now. And we see a lot of the dangers, and that might be why some of you aren't super eager to use AI tools. So things like hallucinations, deep fakes, bias. So we know there's bias in AI models, just like there can often be unintentional bias in health communications. But we've also glimpsed the promise, and I'm sure a lot of us have the more we use AI, scaled personalization, faster feedback, data-driven insights, and this connects back to the challenges you named around staff capacity and time. Using AI tools can really help us save time and do more with less. So the question isn't really whether we use AI, but it's when and how. Yet, in public health, adoption is still low. And an ASTO survey in 2023 found that only a third of state health departments use AI, and mostly informally. And I talk to health communicators every week, and I know some of you are on this webinar who either aren't comfortable using AI still, or who don't have clear leadership support to use AI tools. So the opportunity is massive, but only if we design AI with our values and in a way that works for us. Our solution at Arclet for a lot of these challenges that we've been hearing and talking about is building Arclet. It's a platform designed as the Canva for public health. It's a single, intuitive way to support your entire communications workflow. And it helps with everything from finding trusted content to customizing it to reflect your local community, to getting feedback from intended audience or community members, and sharing effectively in spaces where we know Americans are getting their health information, and finally measuring impact. And what we're hearing is that this approach is saving time and reducing duplicated effort and wasted resources when it comes to this work. And we know we don't have resources to waste right now. And that ensures that messaging is engaging and measurable. So our vision is a country where every community has access to trusted science-based health communication, and that is delivered by local voices, powered and scaled by simple but modern tools and technology, and measured for real impact. So again, I know a lot of you here have seen Arclet before, but I'm going to pause here and give you a quick peek, because I think that helps understand then how we're starting to integrate AI into this work. So this is Arclet. It's a really deceptively simple platform that is built off of thousands of hours of co-designing with our peers, not only in Western North Carolina, but across North Carolina, and now in 16 other states. We have local communicators who are using Arclet and giving us their feedback. So you can search for a health topic. We're up to around 1,200 assets in our library across, I believe, around 70 different, 70 trusted public health content creators. So in this case, I'm going to filter for one of our content partners, North Carolina Health and Human Services. That's never happened before. There we go. I can filter by priority audience, by editability. So whether a lot of the assets in the platform, if they're created by someone where the terms of use don't allow the asset to be edited, the editing functions don't show up. NCDHHS allows all of the assets to be edited. So we can see here, this example, I'm going to pull one up. We can read more about the message, about where it came from. My Wi-Fi seems to have slowed down a little bit. I apologize about that. So you can read about the asset. You can rate and review it. So we have a feedback loop. This is one that is allowed to be edited, so you can put your own local branding on it so that your community knows that it's coming from you. And you can also request feedback. So we support creating reviewer groups. So you might have a veterans group in your county, a mental health task force. They don't have to have an Arclet login. They receive an email with a link to click and can leave their comments and feedback in real time. And then once you have the asset the way you want it, you can publish directly to your socials. Right now, we have the ability to connect to Facebook, LinkedIn, and Instagram. You can schedule posts. So our goal is to replace the need for a super expensive generic marketing tool like Hootsuite and have everything in one place. And then once you've posted to your socials, all of your analytics get pulled into your analytics dashboard where you can track reach, engagement, comments, and that's just a little bit of the functionality. Wanted to give you a little taste of what we're building with Arclet. So we're constantly, as I said, constantly refining and further developing the platform based on user feedback. And our roadmap Our short-term roadmap includes things like accelerating and expanding the content that we have in the platform, including more video assets, flyer and brochure templates, so online and offline health communications assets, enhancing the observance calendar, and building out analytics and admin tools to better equip our users to collaborate with each other internally and with external partners, and then evaluate their success and track impact. So then the question becomes, how do we actually leverage AI in this really important work? And it's not just about throwing AI on there. It's about doing it in a way that's deeply integrated into our users' workflows, that they can trust, and that consistently applies public health and health communications best practices. So this requires a really thoughtful, human-centered approach to AI development. And thankfully, we're not starting from scratch. And I invite you, if you have resources that you love, I'm going to talk briefly about resources at the end of this webinar, but if you have resources that you love, go ahead and share them in the chat. But what I'm showing you here is there are guides like the ethical use of AI in public health communication, which was published recently by Discourse Labs and the National Public Health Information Coalition, NIFIC. And this provides a really helpful blueprint. So their paper outlines 5 interconnected principles that are essential for responsible AI implementation in our field. So the question for us at Arclet became, how do we put these recommendations into practice, building our tools in a way that really embodies these values? And to do this work properly, we knew that we needed dedicated resources. An AI engineer, yes, but not just an AI engineer, but also the space and time to really deeply consider and co-design these ethical approaches. So this led us to apply for and be awarded a highly competitive National Science Foundation Small Business Innovation and Research Grant. About a year ago, we were awarded it in September 2024. And this really critical funding supported us in investing in rigorous, thoughtful development of Arli, our health communications co-pilot, ensuring that it's built on the foundation of public health values and input from the practitioners that we work with every day. And from the beginning, we said we wanted to partner with WNC Health Network and the Western North Carolina Health Communicators Collaborative to make sure that what we were building was shaped by local needs and voices. So our platform's built by and for local health communicators, and we wanted our AI explorations to uphold that same value. So communicator feedback is incorporated into every aspect of this process. So our goal was to leverage AI, specifically a large language model or LLM, to deliver health communications that are not only relevant and trustworthy, but also deeply adapted to local contexts. An LLM is an advanced AI that understands and generates human-like text, and it was initially developed using massive amounts of general data. And our project focused on tailoring it for public health. This involved a really rigorous development process. So first, we identified foundational language patterns. Then we collected real insights from interviews with local communicators and community members. And we included data on health inequities, starting with North Carolina. And we then we used these insights to create relevant examples that guided Arli, our AI, to generate messages and message feedback that resonate really authentically. And then we test those with our community members to make sure that they're accurate and that we agree with the kinds of feedback that we're getting. So this process underpinned the development of Arli, Arclet's AI co-pilot, designed specifically for health communicators. Arli leverages the OpenAI API to simulate a panel of community members led by a simulated health communications expert. And again, these personas were created by us, by actual people, under an IRB process, conducting interviews with folks who volunteered their time to participate in this work. The goal is to provide comprehensive feedback on your uploaded image and caption in the platform or any text-based content to make sure that it's effective and culturally relevant for the audience that you're trying to reach. So I'm going to show you Arli in just a minute. But first, I think what's really important to understand is you might be wondering, well, like, how is Arli different from just using ChatGPT if what you're building is also using OpenAI? And that's a really important question. So we've outlined some of the ways that it's different here. So first of all, it's purpose-built for health communication. It's leveraging local and expert data. It's not just general web scraping. We have inline citations to be really transparent about where the feedback is coming from. It's a co-pilot model, so you're always in control of the AI, and it's community informed. So it's grounded in interviews, equity data, community testing. And our work with WNC Health Network and the Health Communicators Collaborative has shaped every step. So I know I'm seeing several of you are on the message on the webinar here today. Feel free to shoot out a little emoji so folks know that you were involved in giving feedback, or maybe even this room here, in the room here for this photo I'm showing here. From persona development to prototype testing, our partners in Western North Carolina have ensured that our AI work isn't just theory, it's practice. And it wasn't just overnight. So I also want to really credit the collaborative for having created a space where they're talking about AI for years now, well before we were doing anything with Arclet or Arli. They had ongoing dialogues that helped demystify AI, address concerns, and collectively explore how it could benefit public health communication. So this was groundwork that was really crucial in fostering an environment where we could experiment with more with how we could ethically use AI for this tool that we're exploring together. And the way that we worked together was shaped, again, as I said, around data sources, identifying data sources we wanted to use for Arli, conducting interviews to shape the personas, and testing and giving feedback on early versions of Arli. So here's some of what we learned. And I think this is important to share because this shaped how we've been doing Arli, but I think it's also for a lot of you who are doing AI work, I think it's important to share with you. And this early data that we found from our community feedback was very promising, and it validates this human first approach, which isn't a surprise for any of us who have dedicated our careers and our work to doing human first work. So even though with the folks we were working with, even though utility of AI overall was still quite low, just like it is, as we see nationally, there was a lot of interest in Arli. And some of the things that we learned is that it was really important to them that this AI work was integrated into a tool that was helping them with their overall workflow. It wasn't something separate that they had to go to, because we all know when we're overwhelmed and under-resourced, we don't need 10 new things or places to go to try to figure out how to do our jobs and how to do it well. That's not saving us time. So the fact that Arli is integrated into Arclet is really critical. The feedback underscored the importance that they want AI to enhance but not replace human judgment. That was very important. So we really worked to integrate these human in the loop interactions with Arli, which you'll see when I show it to you in a second. And then they felt like it was really important to have a role in shaping and iterating the AI. So that's also been built in to how we do this work. Okay, so now I'm going to show you what Arli looks like. So coming back to Arclet, I talked about Elaine, and I talked about whooping cough. So in this example, I'm going to do a search for whooping cough. These are actually a lot of assets created by the Western North Carolina Health Communicators Collaborative. So I can come in here. I have this asset. I have a draft asset. I'm in a draft caption to start with, and say I want to get some input from Arli about how to think about tailoring or whether this is going to work for my intended audience. Right now, Arli is this little smiley face down here in the corner. it pops up and I have the ability to opt into using the AI. So this is the case when we're doing such significant AI work in the platform. You will know when you are using AI. So it says, would you like advice on customizing this content to suit your audience? We can help with Arli, our AI health communications assistant. So I can either say, nope, I'm good, or I can say, I want Arli's help. Here I can come in and I can describe my audience. This was also from feedback that we heard from our users. We started with having some kind of like demographic checkbox kind of things that they could check off to describe who they were trying to reach. And people let us know that they really wanted to use their own words to describe who they were trying to reach. So maybe I would say, I'm trying to reach moms. I'll say moms of young children in Western North Carolina. I hit Ask Arli. Arli does take between 45 and 90 seconds to think. And so Marian used the example of a cooking show where I'm like basting the turkey and then I turn around and pull a turkey out of the oven. So I'm going to switch to this other tab where I already had it run the feedback. So here you can see Arli is giving feedback on the image itself, on how to simplify the text. It's giving, and on placement, it's giving feedback on the caption of how I can think about adapting the caption. And it's helping me understand whether it's aligned with best practices for health communication. And then it's including sources of where this feedback is coming from. If I'm not so into the feedback, I can I can try again. If I like the advice, I can say, I like this advice, and then it asks me for my feedback. And what I would love to ask all of you is, please make sure you're giving feedback, very honest and open feedback with us, because this is still very much a beta tool, and we collect the user feedback we get, and we use that to work with Mason and our development team to improve Arli, and we can't do it without you. So I can say something like, this was helpful, but I'd love more feedback that feels specific to Western NC. And then it submits my feedback, and then it reminds me, hey, you're just one person. This was created, you've had AI to get feedback, but now you should ask some actual humans in your community, and it's prompting me to use that feedback loop. Whereas here I can go click on, say I have a group, some moms from our WIC program at our health department who've agreed to look at messaging, like urgent and timely messaging that I'm creating. I can send it out to them and say, this is what I've come up with. What do you think, before I share it more broadly? So that is Arli in a nutshell. And before I go any further, of course, I hope that you're like, oh, that was cool, that was interesting, and that you like what you're hearing and seeing so far. But it feels really important to us at Arclet to name the challenges that we're experiencing, both with what we've built so far that we're showing you, and with overall our AI work. So some things like our approach is quite elegant. The fact that we're doing these personas, very cool that we're doing this. And that means that the processing speed is slower. So we've been worried about people, like users, losing interest, thinking that it's not working, clicking away. That's something we're exploring. The Arli results definitely need to be more localized. That's something we're exploring. It's a work in progress, and that will improve as we have more partners who are, again, giving us feedback and helping us understand how to better pilot how we're shaping Arli to reflect the community needs and context of your local community. We're moving at the speed of trust. So we're also developing AI in the way that our users are ready for. So when we started working on Arli, we could have had Arli doing things like, generating images or editing images. The AI tools, when we started this a year ago, the AI tools weren't really there. They're much closer to being there now, but our users aren't there, and that's totally fine and appropriate. So we need to, a big part of this work and how we're doing it is understanding What are you ready for? What are you comfortable with? And how do you want it to work in the platform? We're also navigating our own comfort level with talking about AI. So we've been doing this for a year, but we're not experts. I would say Mason, like, I'm not going to speak for Mason. Mason is like an expert on AI and on a lot of other really cool things. But we felt like, you know, it's important that we talk about this work even when we're uncomfortable. And it's important to talk about it in a way that's transparent and that's vulnerable and that helps create space for all of us to be having these conversations. The workload is high. There's a lot more work to do. This all costs money, and funding opportunities for exploring AI are, it's challenging. So the funding that we got from NSF a year ago, in our proposal, we spoke very clearly about wanting to reduce bias in AI, do more culturally relevant health communications that would help address health disparities in communities. If we use that language in an application now from a federal agency, we would not get that funding. And in fact, we did not get follow-on funding from the National Science Foundation. So we really need more funding opportunities to support this kind of work in our field. All that said, we're still going. We're taking the AI, the Arli prototype, we're getting feedback on it, we're asking you for feedback, we're exploring how we integrate Arli throughout the Arclet platform and the workflow, but we're doing it in phases so that we can do that with a lot of intention. So right now we have AI in our caption editor, we have a beta communication strategy builder tool on the Arclet marketing site, which some of you may have tested out, that we're getting feedback on. And we have Arli launched in this asset editor. But in the future, what we're planning on is using AI for a more intuitive library search experience. Like I said, integrating Arli throughout the platform, but then also really cool stuff like translation support, image editing support, and things like accessibility, plain language, alt text. These are all things that our users have told us are critically important to them. And AI is going to help us do it at scale in a way that helps us all, whether we work in a little community organization or rural health department or a hospital system or a big city health agency. That's important to us. And I think it's important to all of you too. So I'm curious to know what kinds of AI features or integrations would you be most interested to see next in Arclet, or it could just be in general. And I'm going to switch over to this Mentimeter and go to the next slide. And this is a word cloud. So it's going to be interesting to see, is it a word cloud or it might just be an open response? So would love to see your feedback. You can type it into the Menti, or you can type it into the chat if that's easier for you. And I'll give you all a second. I feel like I'm glad that my openness has supported you and feeling like you can be open. Like, I don't know what I want to do here. I'm seeing a lot of alt text, accessibility support. Awesome. Ability to modify images, translation, sources used to write content, ability to push content into non-traditional outlets, meeting people where they are, citing sources to combat misinformation. Awesome. Great, keep it coming, and we will share, when we share out the slides and the recording of this webinar, we'll summarize what we're hearing as well and share it back out with the group. Great. So to circle back to the ethical framework for AI, this is where human first really comes alive in Arclet. So you'll always know why Arli is making a suggestion with really clear attribution to sources, and you'll always have the final say. because Arli is a co-pilot, it's not an autopilot. And so our hope is that this helps us build trust and ensures that this messaging and this tool is working for us, and also know that we are also building in an off switch. So if at any point we get feedback from our users that Arli is not working, it's problematic, it's not trustworthy, we will shut it down. So we are user built for our users, and we listen to our users about what they're comfortable with and not comfortable with. So I think probably if you're here, this is something you've thought about, and it's something I think about a lot, and it's why we're committed to having spaces like this where we come together and talk about AI. You might ask why it's so important to support AI in public health communications right now. And as I already said, I'm not an expert in AI, but I'm an expert in health communications. I've been doing this work for 20 years. I'm an A expert, and I'm building Arli and Arclet for us and for our values and with our needs at the forefront. And the reason why that feels really important for us is because this work to reduce bias in AI is at risk. And this means that it's more vital than ever for us as public health communicators to actively shape how these tools are developed and used. And as Joy Buolamwini said in her book, Unmasking AI, AI reflects its makers. And we have a power to transform how AI is created to minimize harm and build a more just society. But in order to do that, we have to try it out, and we have to share with each other what we're learning, and we have to support each other in this work. And we all have a role to play. So I want to just, and we're getting here towards the end, before we get into Q&A, but just wanted to share some really actionable steps for you in your work, especially if you're newer to thinking about or working with AI. So one that feels really important is supporting workforce capacity building, training health communicators to use new tools, to understand AI feedback, to engage communities in message development. And all this is as important as the technology itself. So this includes training in AI bias, and helping communicators and ourselves recognize and mitigate and address the potential harms that can come from bias in AI. So in order to do that, we have to understand how AI works, and that means needing support from leadership to do that work. Second is investing in purpose-built communications platforms. So tools like Arclet, and we're not the only one out there, but tools designed specifically for public and community health, rather than retrofitted corporate marketing solutions that are super expensive, not built by us for us. We need to be supporting the folks in our field who are trying to do this work for us. Center ethics and community voice. Of course, we do this in all of our work in public health. And we need to do that with our AI work. So it has to be developed with really clear ethical guidelines and continuous input from the communities that we're serving. And this includes things like respecting language justice, accessibility, which sounds like a lot of you are really passionate about, addressing potential harms, and making sure that technology amplifies and doesn't replace local knowledge and lived experience. And then fourth, foster cross-sector partnerships. So we need to have more collaborations between public health agencies, tech developers, community organizations, academic institutions. This is all really important, and we need to raise up our voice, particularly with some of these big tech companies and policymakers, to make sure that we have a voice that AI is taking into account these issues that are so important to us, like environmental health, like addressing health disparities. And then finally, evaluate and share your learnings. So that's, even though we were super nervous to have this webinar, that's part of what we're committed to, embracing ongoing evaluation of this work, and being very transparent, sharing our knowledge, and helping our field evolve. So we're not trying to hide or hoard this information or our resources. We want to help move all of us forward in a way that makes sense for us. And here are some tools that my team's really appreciated to learn more about AI and how we co-design innovation. One of the things I'll just shout out here is like this newsletter. It's a daily newsletter called The Neuron. Marian and I both read that. That's like, you read about all these wild new tools and the latest news, and it's not geared towards public health folks or public health practitioners. And that's part of why I actually find it so useful and interesting to just keep my finger on the pulse of what's happening in the AI world. But then, of course, it's also really important to follow and support the organizations that are very interested in AI security, AI ethics. And I wanted to give a shout out to opportunities that are out there. Our partners at the Public Health Communications Collaborative are hosting a webinar on AI next Tuesday that you can sign up for, and that I'm sure will be really interesting. And then I also wanted to make sure everyone knew that OpenAI has released a funding opportunity for nonprofit organizations. And it's only open until October 8th. So it's not a high lift application, but it's a narrow window. And if you are interested in trying to go after some of that funding, Marian and I are happy to email you some of the information of what we've learned that application entails and what some of the requirements are. But hey, let's get some of that money. Let's get some of that money to do this work. So we didn't build Arclet alone. I hope that's very clear from the conversation so far. We won't evolve it alone. And if you want to help shape the future of AI and public health communications, we'd love for you to join us in the work that we're doing. Many of you already have. So if you haven't already, sign up for Arclet, test Arli, share your feedback. We're also looking for additional pilot communities that are interested in doing AI work. So if that's something you want to talk about, talk with us about that. So before we move on to the Q&A, one last question for you all. What excites you most about the potential of AI in your communications work? You can type it in, you can do it in the Menti, or you can type it into the chat. Wanted to leave this on a really positive note. I think we've talked a lot about the challenges, the concerns. Also just want to hear, where is it sparking something for you that you're feeling excited? And this can have, it's totally fun if it has nothing to do with Arclet or what we're talking about today. So I'm seeing streamlining workflows, sharing best practices at scale. I love that. Yeah, that's a big part of why we've built Arclet. It's just 20 years working in health communications. I just got so frustrated at feeling like we're still very siloed in our ability to collaborate and communicate with each other, especially when we're busy and we're the people who are most on the front lines of doing this work have the least time to do things like read peer-reviewed journal articles. So how are we helping create lift for all of us to do this work? I'm seeing a lot around efficiency and time saving. Awesome. Thank you so much. Well, we have time for some questions. So I've been just doing my thing and not able to see what's going on in the chat. So Marian, do you wanna help pull out a few questions that feel like or discussion points that we want to open up? Or are there any questions that Mason could help answer? What do you think?
Yeah, I have been monitoring. This has been a really helpful chat. And actually, it hasn't been a whole lot of questions. It's been a lot of like ideas and suggestions. I think Haley Fick wins the award for most active in the chat with some awesome ideas and some suggestions for some tools.
Right.
Heather Lanthorn, dear friend of ours, shared a suggestion of a new North Carolina-based organization that does work on accessibility. And then some good questions on just like our platform roadmap. So Marina Del Rios was asking about the future of a possibility for a Spanish language interface of the platform, which is definitely on our roadmap. There were some questions about alt text, but I think that got discussed. Haley shared a link to a Texas Public Health Communicators mini course on AI and health. We can send some of these out. Like we'll do, if anyone else has other resources that they want to share, we can compile. And when we put out our newsletter with a recording of this webinar, we can also have like suggested resources. And if you have other questions you want to email us too, we can put together an FAQ like Adrienne mentioned.
Great. I love that. I'm kind of jealous. I'm going to definitely go back and read the full chat after I eat some lunch.
Yeah. Yeah, there were some great ideas.
Any other questions that y'all want to type into the chat before we wrap up today? Okay. Great. Well, you have our email. Please reach out anytime. And thank you so much. Thanks to all of you for being here today and for your interest. We'll send out the slides and the recording and the resources and the input that we heard from all of you. So appreciate you.
Thank you, everyone.
Thank
you, Tracy. That's really nice feedback. Thank you.
Thanks.
Yes. Thanks, Haley. It's always fun to show behind the scenes.
Bye, Jen. Bye, Mason. All right. Thanks, you all.
Yeah, great to see you, Amanda. Thank you.